Okay, right. In endocrine, fresh as a cucumber. Nawal, are you tired? Right, okay. In endocrine, there are typical topics which keep appearing. Okay, all I want from this question is a correct answer, please. I am leaving it you to read for me. Naba, take your time. Naba, I don't have a glass of milkshake. It is not fair. You keep reminding me, and this brings water in my mouth. So, 53-year-old woman presenting with dull gray brown patches. What is the diagnosis? Sadia Rashid. So, what is the correct diagnosis, please? And why you think this is A? This is Addison disease. Why? Josefa, hyperpigmentation. Does she get hyperpigmentation? Let me see. Okay. Addison disease, primary adrenal insufficiency, postal hypertension due to reduced aldosterone, pigmentation due to MSH. So getting diagnosis correct only might not suffice in the exam. Sometimes they ask more than that. So can you tell me what do you see in this picture, please? On the left, gray brown patches. Exactly. These are gray brown patches in your oral cavity, gray brown patches here and on your teeth, gums, in the creases of the hands. So these are just few pictures to remind you what is meant by hyperpigmentation. Okay, Hassan Parvez, did you get it? Melanin deposition, correct. Okay, now moving on to next question. Give four signs of hypothyroidism, not including weight gain and the hair. So you see that we have given you the diagnosis, but the story is far from that now. So what are the four signs of hypothyroidism? When you answer, never ever include those features which have already been given. So, okay, most of you are getting it right. Let me tell you, my experience tells that once you have seen a patient of hypothyroidism, a good going hypothyroidism, you will always remember it. So my four signs would be bradycardia, slow relaxing reflexes, ataxia, cold freeze, ascites, puffy face, and goiter. Yes. What is the most likely mechanism causing her hypothyroidism? If you answer me this question, I will give you gold medal. Mechanism. What is the mechanism? Tahir, spot on. It is autoimmune actually. I think that you have seen my paper. Autoimmune. Mama Tahir, have you seen my paper? Okay, I trust you. What medication will the GP prescribe to treat her hypothyroidism? Thyroxine, levothyroxine. What biochemical test would the GP use to monitor TSH, thyroid stimulating hormone? How often should the GP aim to monitor treatment until levels are stable? Sadia, you should know this. Sadia, I need the how often should you do this test? That is what I have learned. 1 month. How often should the GP aim to monitor treatment until levels are stable? Right. Explain the feedback system involving the TSH. Let me show you a picture in response to this. That will be quicker. So please, can you revise this with me? Coming from hypothalamus, TRH, thyroid releasing hormone, to pituitary, and then to thyroid. And from there, you get T4 and T3 acting on the peripheral tissue, where T4 is converted to T3. So that is the mechanism. Let me show you a picture if I have. So that is a picture. Please have a quick look from hypothalamus via TRH to pituitary, from pituitary via TSH to thyroid. From thyroid, you get T3 and T4 acting to the tissue. In the tissue, T4 is converted into 3T3, which is your actually peripheral acting agent. Are we clear on this? I need few yeses before I move on. Thank you, Tahir. Yeah, excellent. Okay, so that is the mechanism. Just a quick reminder. I'm sure that you know these things. What I'm doing is just giving you a quick reminder and quick revision. Okay, this time again, I'm not reading. You read it for me, and I will share my knowledge with you if I have any. Sumera, what is the answer? So there is little bit of confusion going on. People can't agree on the correct answer. Coarse facial features, that is the giveaway. Sajid, you are spot on. This is acromegaly. Coarse facial features, increasingly tired, generally weak, and he has gained weight, sweating easily. Acromegaly, commonly due to pituitary tumor. Glucose tolerance test is diagnostic. So GTT is the diagnostic test, and you get coarse features like this: mega eyebrows, big tongue, macroglossia. You see, jaw has gone bigger. Look at the teeth. There is a distance between the teeth. Big jaw. This is normal hand. This is big hand. This is normal foot, and this is big foot. So this is how you get the coarse features. Remember, remember few things. A, coarse features diagnosis when acromegaly is suspected. You do GTT. That is diagnostic, and these are your course features. That is all you need to remember. Occasionally, you will get it as a short case in the exam. This can appear if there is a patient in the area. Right, okay. So next slide, moving on. We are making good progress now. Well done being with me and helping me to maintain the speed so that we can cover as much stuff as we can. Probably this is slightly more difficult, maybe. Guys, help me to get the right answer. To be honest, my feeling is that you people are clever and you really don't need me. I'm very pleased to meet all of you. You're getting it absolutely spot on. Absolutely correct answer. It is SIADH, syndrome of inappropriate ADH. That is why your output is low, and that is why you have got a low sodium because your whole blood, your plasma is all diluted because you are retaining water due to a syndrome of inappropriate ADH. Excellent. So that will save me time. So that is your answer. Right. I'm not spending time on previous question. Moving on. Guys, read it and give me the correct answer. Zareen Fatma. Zareen Fatma, whereabout are you in the world? So most of you think that this is diabetic acidosis. Thank you. 17-year-old girl, diabetic ketoacidosis. Remember one thing, when you are in the exam, think simple, think common. Common things appear commonly in the exam. The principle is that examiner expects you to be knowing everything about common things, and common things appear about an uncommon diagnosis. So that is the principle. So diabetic ketoacidosis, excellent. Now have a look on this diagram. Hyperglycemia is not only due to diabetic ketoacidosis. This could be your differential diagnosis. Ketosis can be due to these three reasons: alcohol, ketotic hypoglycemia, and starvation. And acidosis has their own. So when you are thinking about diabetic ketoacidosis, remember that you are aware of these other diagnoses. So, Abira, are you with us? Abhijit. Abhijit, you have been very quiet. So, if you're happy, I will move on. So, remember, hyperglycemia has more than one reason. Ketosis has more than one reason. And Abhijit says that he is with us. Excellent. Very pleased to have you. Other metabolic acidotic states, lactic acidosis and salicylism, uremic acidosis. So keep your eyes open. Excellent. Right. Okay, guys, give me the correct answer. What is the most likely diagnosis? Another gold medal is in the pipeline if you give me the right answer. Ahmad, what is the correct answer? No, I disagree with that. Sumera, I disagree with that. I still disagree. Someone has to give me the correct answer. Muhammad Tahir, you are, I think, right. Let's see what is the correct answer. Graves' disease, pre-tibial myxedema, clubbing in the fingers, and thyroid arthropathy and visual disturbance. Right. So please read the question and let's see why we couldn't get it right. Maha, your answer is correct, as is Bushra. Zareen, correct answer, brilliant.